Welcome back to the Armor Men's Health Hour with Dr. Mystery and Donna Lee.
Hello and welcome to the Armor Men's Health Hour. I'm Dr. Mystery, your host, here as always with my very radiant, but somewhat, giddy office manager and co-host, Donna Lee.
That's right. I am your professional co-host, board certified.
We're award-winning.
We are. We have the awards right here.
We have awards that we've given ourselves, like
That's right.
the Yum Yums and Dinglings Award.
And Excellence in Radio, and voted Best Podcast in 21 and 2022.
None of those things are correct or real. But thank you so much for the self-love that you're giving us. I am a board-certified urologist and a men's health specialist. We do have a couple of awards that we got that are legitimate.
That's true.
Austin Monthly voted us
Best
one of the
Urology.
top urologists. And
Austin American Statesman.
Best men's health.
Wellness. Probably because of this show.
Men's
because of
health.
the awards.
That's right. Because
You're welcome.
That's right. That's right. You do get an Oscar sometimes after an Emmy. If you gave yourself the Emmy.
We just compared ourselves to Oscars and Emmys.
There's no me and Emmy. No, I guess there is backwards. This show is brought to you by NAU Urology Specialists, the practice that we started in 2007. Donna, tell them about our practice and how to get a hold of us.
That's right. You can reach out to us at 512-238-0762. We are in Round Rock, North Austin, South Austin, Dripping Springs, Texas. We have 4 MD surgeons. We have 5 mid-levels. We have 2 pelvic floor physical therapists. We have sex therapy, sleep study. We have all sorts of fun things on site.
Because we are committed to taking care of the whole person, not just your prostate and dingling and yum-yums.
Well, we take care of the nipples to the knees.
Nipples to the knees.
But we'll help the other parts.
We'll help the other parts, too.
That's
and
right.
when it comes to taking care of your whole body, we really try to emphasize preventative care, even though we really perform sick care. I mean, most people that come see us are coming to us for a problem,
right?
Not necessarily to stay healthy. Who you should be seeing to stay healthy is your primary care provider, and not just because you got a stuffy nose or hurt your shoulder playing tennis.
Right.
So to tell us about initiatives and how we take care of chronic conditions, I have Dr. Billy Franklin from Victory Medical Center. Thank you so much for joining us today.
Well, thank you for having me today.
So one of the problems with preventative care is that nobody's incentives are aligned, okay? The doctor doesn't get paid, in people's minds if you're healthy. The patient doesn't want to be inconvenienced to coming into the hospital when or to the doctor's office when they're not sick. So you almost have like a misalignment. It really takes a society, something on a bigger global scale to put everybody in the same direction, and that's where we talk about quality care initiatives on doctors, that you get paid more if your patients stay out of the hospital, and towards the patient so that you don't have to pay as much if you stay healthy. And so I thought you could comment on that and how maybe the government and insurance plans are changing.
It's much better to do preventive care and much cheaper. I mean, if you take a car, for example, if you change the oil regularly, you're going to avert a terrible engine seizure or failure. Whereas you wait for the engine to seize, it's expensive and possibly life-threatening for that engine. And the same thing is true for people. We have to do things like eat right and exercise. And even though that sounds cliche, there is a multitude of benefits for that in terms of our health. And so a program that has recently been initiated by Medicare, which for those who don't know, Medicare is a federal government program that was created to take care of people that are 65 and over. And it provides payment for all medical services for patients that are over 65.
And it's not free. I mean, we paid for it in our taxes and our payroll taxes all throughout our working years to get that benefit when we're 65.
That's true. And it also now has a copay and a monthly premium. So it's really not free.
And so what have they tried to do to help us as physicians manage chronic disease?
Well, for a long time, the concern of large healthcare companies and Medicare itself has been the cost of chronic patients. Chronic patients can create a huge drain on medical dollars.
These are going to be chronic patients like people who have diabetes or congestive heart failure or high blood pressure.
Exactly. Those are perfect examples, although there's many: dementia, obesity, addiction. There's a lot of chronic conditions that, if managed correctly, can prevent hospitalizations and not just save people's lives, but save the government money in the process.
And so what are they going to do to help us?
Well, they created a couple of different programs for that. One is called the CCM program, which means Chronic Care Management. The other one is the RPM Management, which means Remote Patient Monitoring. And in remote patient monitoring, you take a medical condition like diabetes, for example, and instead of going to the doctor every year or every 6 months or every 2 years, your blood sugars are transmitted automatically to the doctor's office on a daily basis. And so your physician and the monitoring medical team can see when there are problems with your sugar and not wait until there's a disaster and your sugar is too high or too low.
It's like having a doctor like on your shoulder all the time.
It's exactly like that.
And then what are some other remote patient monitoring type equipment that's out there?
Right now, it's approved for blood pressure, diabetes, and congestive heart failure. But my sense is in the future, there'll be more things. And I say Medicare. United Healthcare, I think, has opened the gate to allowing for CCM and RPM as well.
Why this is important, in my opinion, is that just going to the doctor arbitrarily, we tend to kind of write off a lot of things. You measure their blood sugar and they're like, oh, I had a Snickers in the parking lot, or they're like, oh, my weight's up, but because I, wearing pants today, or their blood pressure's high, they're like, oh, I just got stuck in traffic. You're always trying to
I'm wearing pants today.
yeah. Well, we're a urology office. Sometimes you don't wear pants. And so the problem with making decisions only in the confines of the four walls of that clinic room is that the patient themselves often have a lot of reasons why they don't really suffer from what you're telling them they suffer from. And so by doing things in their own home, in their own environment, where they're living, I think you're getting a much more accurate picture of that patient too.
Yeah, much more accurate. I mean, even getting away from the confabulation of finding causes for the disease, it's hard to just get in to see the doctor. There's a lot of barriers to seeing physicians these days. We're overwhelmed, and with the very limited pay that comes from insurance companies, we have to see huge volumes of patients. So it's hard. It's hard to just get in, period. And so monitoring your blood pressure every day versus once every 6 months or once every 5 years is just a million times a different care level.
And I think that to individualize care, it also helps because, as I talk about on the show often, what is normal for you may not be normal for somebody else. Your targets for blood pressure or cholesterol or weight management might be more tight than someone else because of an underlying condition. And the diabetic care, I couldn't think of a more important one where if you really control it, you can avoid a lot of late-term complications of that disease.
Yeah, that's absolutely true. I think there's a tendency to want to create, quote, normal ranges for disease or normal treatments in order to make them easy. But as they say, normal's just a cycle on the washing machine, and people should have individualized care because it is different.
I like that. Normal just cycle on the washing machine.
You need a better washing machine.
That's right. You need one with all sorts of fancy buttons on it. Maybe one that checks your blood pressure.
Well, that'd be cool.
That's right. And if you are out there and you have a chronic medical condition, the reason we're talking about this today is because your physician needs to be equipped to be able to provide this care. It's just not just we're not just saying it. But not all doctors can do it or are doing it.
No, that's true. It requires specific equipment, and I think you have to embrace telemedicine to make it work effectively too. Because when there's a change and changes are frequent, it's much easier then to communicate with the patient via telemedicine than it is necessarily to have them come to the office every time the physician sees a remote problem in their house.
That's a good point. So you yourself as a patient, if you want to take advantage of some closer care for your chronic your chronic medical conditions, you have to be open to being able to communicate with your doctor via, I guess, over some type of electronic device.
Yeah, I think it removes a lot of the difficulties in getting to the doctor and communicating with the physician.
And from a time efficiency standpoint, it's just much better.
It is, and there's a care team involved with this, so there's always somebody to communicate. There's always someone watching over you.
So chronic care management and remote patient management are both services offered by Victory Medical Center, right?
Absolutely.
And so when somebody is part of your practice, and right now if they're Medicare or even to some degree United Healthcare, they'll be offered this kind of program.
Yeah, we strongly encourage it. It's better medical care.
It's better medicine. I can't thank you enough for joining us today and really talking about what I think is a really innovative way to help patients with chronic medical conditions avoid hospitalizations and downstream medical effects. And the fact that your practice is providing it really says something about you and the practice care that you give.
I greatly appreciate that.
All right. Well, Donna, how do people get involved with Dr. Franklin and Victory Medical?
That's right.
And certainly those of you that have chronic medical conditions that need closer care, I would encourage you to do so.
For sure. Y'all are taking new patients, of course, Dr. Franklin. You can reach out to Victory Medical at 512-462-DOCS. That's 3627. And their website is victorymed.com. They're in South Austin, Westlake, and Cedar Park. And then taking over the world.
Taking over the world. They're going to have to follow us.
That's right.
We're worldwide.
Just the podcast.
How do people get a hold of us, though, Donna? Don't forget us.
That's right. 512-238-0762. You can always ask for me. I'll answer the phone if you ask for me. ArmorMen'sHealth.com is our website, and our email address is ArmorMen'sHealth.
And she will answer the phone.
I
It's
will,
probably
because
the
it
biggest
stresses
kind
me
of
out
thing,
if they
the
don't
biggest
answer the
ego
phone.
of her life. That somebody wants to talk to Donna, listen to this.
Our email address is armormenshealth@gmail.com, where you can send your amazing questions that you will end up hearing on a podcast, probably in Asia or Europe.
That's
So,
right.
Thank you for listening. Thanks, Dr. Franklin.
Domo arigato.
The Armor Men's Health Hour will be right back. If you have questions for Dr. Mystery, email him at armormenshealth@gmail.com.